and welcome to Healthcast by Happiest Health. Today we are going to talk about delay in periods. Today we have Dr. Sharvari Munde, a gynecologist and fertility specialist. Hello doctor, welcome to the podcast.
Thank you for having me here.
Many women undergo delay in their periods. They experience it a lot and it is very common these days. What might be the reason behind it and what causes it?
So basically we have to categorize the patient, whether the patient is adolescent age where she has just started to get her periods. So it is expected to have irregular cycles because your hypothalamus, pituitary and ovarian axis is getting into sync, and then it is trying to get the period normal. So first 2 years or after menarche, that is the first period, is common. Then in the reproductive years, there can be irregular cycles because of hormonal imbalances or sudden weight gain, weight loss, and because of underlying hypothyroidism or hyperthyroidism, what we all commonly know about PCOS, polycystic ovarian syndrome. Again, that could be one reason. Or a very simple thing could be pregnancy, or an pregnancy of unknown location, or there might be some stress issues. These are attributed to reproductive year, work related stress or any stress or lifestyle modification in general. And then coming to the later part after reproduction is the premenopausal age, where again period cycles tend to disappear. So that is a time where it takes almost 1 year. The period is going to come infrequently, irregularly, where the egg count is decreasing and you are proceeding towards menopause. So this can be categorized according to your age wise why they are irregular.
Pregnancy is not always the reason of delayed periods.
Yes, definitely.
So what can we do then?
So basically the first and foremost thing that you should do, even if you are sexually inactive, visit a gynecologist if you are having irregular cycles on a day-to-day basis, on a monthly basis. Like if you have a regular cycle for 12 months and out of 12 months if you have 3 or 4 irregular cycles, that is fine. But if you are ending up having more than 5 irregular cycles, I mean irregular when it is less than 28 and more than 35 days. So if you are having one cycle of 22, the another cycle 30, then 35, this is something which is irregular. So definitely need to consult a gynecologist, get a baseline hormone profile done and baseline ultrasound done to see whether it is concerning or it is just the periodical way of getting the periods. That's it.
We often see that mood swings and cravings come hand in hand when we talk about periods. And it is so common that it has almost become a usual thing. Are mood swings and cravings normal during periods, or it's a
moderation is the key.
Something?
So anything, mood swings and cravings, yes, in some females it may happen. Some people may not even experience it. So basically it is how our body is adapting to the hormonal shifts that are happening. So when you start with your period, the estrogen and progesterone levels are very low. Then as the period cycle commences and you proceed towards your ovulation, that is the time when your estrogen levels are at the highest peak. And then again there is a shift which has happened over a period of 15 days. So suddenly that high level during ovulation, some people will experience slight mood swings. Majority of the mood swings will happen post ovulation when the progesterone level also rises. So both these hormones are at its peak and suddenly they start falling just 3 or 4 days before your period is going to come, the next period. So this shift, some hypothalamus, some brain may not be able to take, and that results in the some kind of, in a common term you can say, a synchronization shift happens rapidly. So because that hormone shifts rapidly, that is the time when you can experience little bit of mood swings where your brain is trying to adapt to that hormone. To some people that shift may not be that significant, they might just go unnoticed, but for some people it may take a toll. The brain may try excessively to overcompensate, which results in having mood swings and cravings. So yes, definitely it is common to have it, but it should not go to the extent where you are not able to manage yourself. Then definitely you need some kind of counseling or help.
Okay. What can people do? What can be the first step of taking the counseling or the help?
So basically mood swings where you are going into too much of depression or too much of anxiety, panic attacks where you are not able to control yourself even after knowing that it is a PMS. So there you should definitely go for counseling.
And then there is another discussion which is very common, is color of your discharge. And color of the discharge indicates if you're healthy, if you have any underlying disease.
Yes. So
what
the
about
vagina
it?
comes with its own color coding system. So it maintains its cleanliness and its hygiene by showing you the colors. So basically if you have a clear discharge during your ovulation, that is a cleansing part which is happening during the ovulation. Then there can be some curdy discharge during the later phase of ovulation. And then when you get your periods, you have the normal bleeding, which is usually dark red or red in color. But intermittently, some people may have spotting that may be a brownish discharge. But the alarming signs where we should get concerned is a greenish discharge, yellow discharge, which is also associated with itching, redness, burning, and pain. So these are the symptoms where it is little worrisome. So better to get examined and rule out the cause and then get the medication done right away.
And I've also heard that period blood color
Yes.
is also different in different people.
The lining which has been growing all through your 28 days or 30 days is trying to shed away because we are proceeding towards our next cycle. So whatever is there from the previous cycle, we need to lose it. So it starts with a little brown discharge, but usually it is overcome by a red color discharge, which is again overtaken by the brown discharge, where the healing process starts in the lining, and then it is like just the scarring that happens when we get hurt. So in that the scabbing is going to happen. It is that kind of bleeding you can consider. So dark red is fine, and any blood duration, any bleeding of more than 7 days should be concerning. Or if it is associated with passage of clots, that is big cottony balls of blood, that is also again concerning.
And what about the smell?
So every vagina is going to have a peculiar smell. So it is not that it is going to smell of flowers and aromas. So every vagina has a typical smell, and we should respect nature. But if something which is disturbing, if it is a fishy smell or some smell, if you feel that it is disturbing, or sometimes that smell may go to the other person also, then definitely, and again, if only the smell is accompanied with pain, itching, then it is alarming. So always we are going to correlate it. But something which is disturbing, something which is accompanied with alarming signs, needs to be addressed.
Talking about smell, there are a lot of products in market
Yeah.
available which are anti-smell products. What do you think about those?
So basically, the beauty of vagina is that it is a self-cleansing organ. It does not actually need any sort of cleaning because it is self-sufficient. So even moderation is not required. Vagina comes with a particular acidic pH. So that pH will anyways protect you from any kind of unknown bacteria or any other viruses or fungal infection. So no matter what happens, nobody will tell you to use a vaginal cleanser or something like that. It is not at all needed. Only when you feel that there are some alarming signs, there is some curdy discharge, greenish discharge, some flaky discharge. So that is when you will need medications, not the wash. Because even after washing the vagina, it may have chances that it may reoccur, regrow. So we don't need to wash the vagina, we need to keep the
Treat
vagina
it.
hygienic.
Yeah. So as you mentioned about hygiene, what can be the regime?
So keeping a vaginal hygiene is like very easy. First of all is using cotton panties. Breathable undergarments is the key. And then second thing that you can do is avoid using too much of talcum powder, or as we said, discussed about vaginal wash. We don't actually need it. Also, menstrual hygiene is a very, very important aspect of vaginal hygiene. So when you are in your periods, whether you are using a menstrual cup or a tampon or a pad, so you should make sure that you change it every 4 to 6 hours. Blood is an irritant basically. Okay, a basic nature of blood is irritant in nature. So if you leave that, it is going to have certain kind of bacteria which are going to multiply. So period blood is supposed to come out through vagina and just come out and wash out. So if you keep it there for a prolonged time, it is going to harbor infections. So vaginal health is also important, menstrual health is also important, and these are few tips that we can use. When it comes to sexually active person, it is always advisable to use barrier contraception, that is condoms. The purpose of condom is to just prevent a pregnancy and STD.
There's another very interesting term going on in social media. It's called period blood facial.
Being a doctor, I respect science, and anything which is evidence-based or scientifically proven is what doctors are inclined to. So there is no scientific evidence supporting period blood facial or any amazing benefits that we have seen. Yes, but sometimes people may get confused with PRP, that is platelet-rich plasma, and period blood facial. So basically PRP is something that we remove your blood and we process the platelets, that is the growth factors which is present in your body, and that we keep dermatologists often use it to put it in the patient's skin for regeneration, rejuvenation, that kind. But period blood facial is something which has been only on social media and definitely not scientifically proven. So definitely a no from my side.
What should men know about periods? How can they be a better caregiver?
So men should know everything about periods, because it is something that is going to happen with their partner, with their mother, with their children, with their girl child if they have any girl child, or their grandmother sometimes. So yes, you must be aware of the fact that a biological issue is happening inside the female partner, and we need to respect that, and we need to take care in basic terms. Like if a female should be open, like if I am a mother, my son is grown up, so I would be like more open in sharing what I am going through. I would like to request everybody that whoever is around you, surrounding you, do not make it something like a girl thing. You can always involve your friends, and always involve your male friends also in your circle. That even if, so for example, anybody will be very comfortable in sharing that अरे यार मुझे headache हो रहा है. Why can't you just say that I am having dysmenorrhea? So we can just normalize dysmenorrhea like any other ache, like a headache, like a tummy ache, like a earache. So we can just normalize things. That would help us a lot. That would help them also normalize this. And as caregivers, we don't need somebody to take care of us as such, but yes, we do sometimes expect help. So something understanding is what we can put it. So we need to educate them first. We need to make them understand what happens, and then only they will be in a position to help us, and they will understand it and normalize it. So yes, basic is understanding, and make them understand that this is the cycle, this is what happens. If you tell them these are the problems, they will find out the solution by their own, I guess.
Just as cravings and mood swings, there are period cramps.
Yes.
Are they bad, or are they any symptom of any disease, or is it completely normal to have cramps?
So period cramps are something which always comes as a baggage when the period comes. But definitely if it is something that is disturbing your quality of life, where you end up taking leave, you are not able to concentrate on your work, you are not able to sit at work or travel to your work, then that is something concerning. For example, in PCOD people, period will come after 3 months, 4 months. So the flow is going to be like heavy. So in those cases also there will be a barrier. So anything which is distracting you and not allowing you to concentrate on your work or go to your work is something which needs attention and medical help. So you should always get yourself tested. Think for yourself after taking the doctor's opinion that which painkiller will suit you, and if any additional things are required when it comes to very bizarre period cramps, like bizarrely heavy period cramps.
You also mentioned about the flow. And it is also a very concerning issue with people having menstrual cycle. Flow depicts something like if it's heavy flow, it's a problem. People are like, they call women as anemic. So how do we go about that?
So basically, see, period flow is like when you come to a doctor, it is very difficult to measure the period flow, because some people will be using pads, some people will be using tampon. It's not like some glass where we fill the menstrual blood and then we measure how much was the volume. This is practically impossible. So something again which we have to look is for clinical symptoms, like if you are changing more than 3 pads in 2 hours or more than 6 to 7 pads in per day, associated with clots like cotton-like balls, and also where you feel very fatigued. So definitely these are the signs and symptoms. More than 7 days of continuous flow. So this is something which is alarming, which is heavy flow. When it comes to less flow, it may be just spotting for 1 or 2 days where you use only 1 pad per day. Again, that is also something which is worrisome. But as long as your periods are coming at a regular interval and you are having a period flow of 5 or 6 days, which is good flow, not affecting your quality of life, and not, if you are active, if you are able to take up the period, and if you are not anemic as you mentioned, if you are not feeling too much tired and fatigued, so just see how your period cycle works in a particular fashion. Every female will have her own story of period. So if somebody who is getting regular periods, 5 days flow heavy, it is still okay if it is not incapacitating her daily life. Okay, so it is very subjective, and we need to evaluate every person as a different individual.
That's all from my side, doctor.
Yes, thank you so much.
Thank you for joining us, and thank you for giving time.
Thank you.